Good evening, everyone. I am Amartya. On behalf of Swast Wellbeing, would like to welcome you all for our today's session on emotional on importance of preventive medicine, role of your family doctor. So, Dr. Jyotika, clinical lead of RxDx SAMANVAY Malleswaram, is a family physician with over wide experience in treating infection diseases, example pneumonia, URTI, cellulitis, UTI, and non-communicable diseases such as diabetes, hypertension, obesity, general and heart health. She is efficient in handling cuts and wounds. Dr. Jyotika excels in women's health, vaccination, adult and travel, and patient counseling, and has a special interest in preventive medicine and community health. She is a prolific speaker on health issues and is frequently invited to address communities as well as medical conferences as an executive member of AFPI Karnataka and Secretary Spice Route Movement India and Regional FM 360 Coordinator South Asia region. Further which she has done her MBBS from C. Devraj Medical College further, and she did her DNB in family medicine from the Bangalore Hospital and also completed her MR CGP International Royal College of General Practitioners, UK. So firstly, heartiest welcome Dr. Jyotika on behalf of our entire team of Swast Wellbeing, and we feel fortunate to have you talk on our platform today. And thus, without any further delay, would like to hear briefly on about our today's session from you.
Thank you, Mr. Amartya, and thank you, Swast Wellbeing, for inviting me to speak about a very important topic. We all have been hearing from our childhood, prevention is better than cure, and apple a day keeps the doctor away. Uh, and I think COVID in the past 2 years has taught us the importance of taking care of our health in a more proactive way. So I am Dr. Jyotika Gupta. I am a family physician and I practice in Malleswaram, RxDx SAMANVAY in Bangalore. I want to take this opportunity to also inform everybody that 19th of May is celebrated as World Family Doctors Day. And hence I thought this is the perfect opportunity to interact and to engage with people and to create an awareness of the importance of family doctor. Let's bring back the family doctor into our lives. So today I will be speaking about the importance of preventive medicine and how it will help us in improving our quality of life going ahead. Mr. Amartya, can I share my screen now?
Yes, absolutely.
Okay. Is it visible?
Yes, doctor.
And is it on slideshow now?
Yes, doctor.
Okay, great. So, although this is the introduction slide, let me give a quick overview of the importance of this diagram here. So we have a patient who lives in the community. The patient needs all these facilities, whether it's primary care, or their lab services, a specialist service, pharmacy for all the medicines, and a hospital for any surgical needs, admissions, procedures, deliveries, or anything else that cannot be handled at home or in the family doctor's clinic. So RxDx is also a chain that specializes in providing family care, family medicine and primary care in the community. So we are the friendly neighborhood clinic and we provide all these services in the community. So let us see what is a disease. So by definition, a disease is defined as a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. So we were taught this definition way back in our MBBS, and it really opens up a lot of components of health when we try to dig into this definition. So if a person does not have an active disease or an infirmity, that merely does not define being free of disease. It is supposed to be a state of complete physical, mental, and social well-being. And I brought this up to start with so that we know that things which do not come up front in the form of a symptom do not always correlate with absence of a disease. And that is where we have to step in and proactively catch the disease before it catches us, before it takes control. So I thought I will start with a few examples of what I see in my
But the slides are
OPD.
not changing.
It didn't move.
No,
Which slide is visible?
only the first one.
This.
Yeah, now it's finished.
Now it's visible. So I was saying disease is defined as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So I thought first, just let me give you all a few scenarios which I see in my OPD on a regular basis, and my colleagues see, and probably if we have people who have joined us, they are the ones who will be on the other side of the table. So first scenario that I want to give out, a 30-year-old gentleman, apparently healthy person, comes for a health checkup. He works in an MNC, has a busy schedule. He's not able to exercise regularly. His diet is fairly okay. Both his parents are diabetic. And when I check his reports are fairly normal. So in such a scenario, what will I advise him? Mr. Amartya, can this be interactive? Like, will people be able to type out or chat or something?
Yes, there is a chat option which is available.
Okay, okay. So I'll just pause. Sorry. Is it visible?
Yes, doctor.
Okay. So what will I advise him? So what is important to learn here is that he is 30 years old, very busy lifestyle, no exercise or diet, and yet his reports and all are normal as of now. Although he does have a strong family history of diabetes. So this is an important scenario which we see day in and day out, and people have to be made aware of the risk that they might be getting in if they do not take an important step to change their lifestyle right now. I'm giving these scenarios and then I will explain what are the different types of prevention that we have to take in and what are the different models of preventive care that we follow. At that time, we will be able to correlate more with these scenarios. So I'm going to advise him lifestyle modification depending on his routine, depending on his weight, depending on his habits. And also I'm going to educate him to take care of his health in a way that he does not go into developing diabetes. Uh, I think a lot of people will be able to correlate to this type of a scenario, which we see pretty often. So this is scenario 2. A 45-year-old teacher, she stands for long hours in school and she also takes online sessions on alternate days. So the COVID pandemic has changed a lot of things, during our, not during, sorry, for even our teachers. And Amartya, just give me a minute. Something is not right. Okay. So we've seen how teachers are also getting used to taking online sessions and they have longer hours of screen time. So this teacher gets frequent headaches and back pain. She does have blood pressure from before. She takes medicines for that regularly and blood pressure is fairly under control. Unfortunately, she also does not have time for exercise Although she does say that she's active because she obviously moves around in the school, going from class to class, climbing stairs, and also standing during class hours. So you notice how scenario 1 differs from scenario 2, where in scenario 1, the gentleman had no issues, but here we have seen this lady has started developing headaches, back pain, and she already has blood pressure. So what do I advise her? I advise her firstly to control her blood pressure, take the medicines regularly, and to avoid worsening of these headaches and back pain. I will dive in deep to know her routine, her diet, and her exercise pattern. Of course, she has mentioned she does not have time for exercise. So I will try to make her understand the importance of even a brisk walk or some form of physical activity, and taking care of the physical health so that these back pains, headaches can be brought under control. So this is the difference between scenario 1 and 2. I have a third scenario. So we have a 70-year-old gentleman. He runs his own business. So we understand that he's healthy, active, and alert. He is a diabetic, which is well under control. Now he is detected to have prostate cancer. So what next? So in this case, it's important to intervene at the right time to have enough information and to investigate the prostate cancer in a proper way. So just to give a detail, this was, this is like it has been detected at an early stage. The patient, because he is active and alert, and he checks his blood sugars regularly, he up on his routine checkups. So at this point of time, I'll have to educate him, thoroughly investigate cancer, and then determine the type of treatment, whether he needs to go in for a surgery, or what are the other various options, what needs to be taken care of, and what else needs to be done with respect to his family members and to his future generations, what advice needs to be given. Well, we do have another scenario, a 50-year-old gentleman who had liver cancer. He's been operated and discharged. He's back home and he lives with his family. So what are we going to advise him? What is the help that he will need from his physician, from his family doctor? So in brief to say, since he has recovered and discharged, he will need a lot of follow-up care. He will need a lot of medical attention while he is at home, and he will need a lot of follow-up with his doctors. So that has to be advised in the right way. Of course, I'm giving a very brief outline of the different types of care that are needed in these 4 scenarios. So in the 4 scenarios that I have mentioned, what are the various differences that I have tried to bring out? In the first scenario, where a 30-year-old gentleman has no problems, so there I am going to advise him so that he doesn't develop any problems that he's at a risk of. In the second scenario, our teacher does have a few simple symptoms. So there I'm going to advise her so that things don't worsen. In the third and fourth scenario, so actually the second and third scenario are very similar. Again, the third scenario where the patient has been detected to have prostate cancer, he will also need advice and proper guidance on how to go ahead to manage that. In the fourth scenario, we already have an existing health issue which has been solved. And after that, what needs to be done? We have to take care. So in every scenario, there is a room for prevention of the disease from going into worsening into the next step. So where does this problem lie? So I want to bring out this particular issue. So, for too long, our healthcare industry has focused on treating the problem after the impact has occurred. So, it's more like a reactive patient care than a proactive patient care. And educating and promoting public health through education and encouragement of healthy behaviors has been seen to be most effective in preventing complications of various diseases. So because of focusing on treating illnesses, the problem that has occurred is that healthcare issues are left to grow in severity before they're treated. And that's not optimal for the patient. Also, it increases the expense of the treatment given. So say, for example, a patient has been educated enough or has been counseled enough to take care so that he or she does not develop a particular disease, say diabetes, or say an infection or high blood pressure. Obviously, the complications because of diabetes, blood pressure, or any other infection can be mitigated in the right time, and the treatment expenses proportionally will be much lesser. And this also, it's an expense to the whole healthcare system, not just the patient. So preventive healthcare, why is this important? So we have this very nice diagram. Screen share, sorry, is this on slideshow, Mr. Amartya?
Yes, sir.
Okay. So why is preventive healthcare important? So firstly, it's simple and easier than cure. It definitely improves the quality of life. So when you compare a person who is a well-controlled diabetic as against somebody who has complications of diabetes in the form of, say, a recurrent infection or vision problems, heart problems, kidney issues, say that involves dialysis or chronic other complications, obviously the quality of life will be much better if certain things, certain complications, diseases are prevented. To delay the onset of major diseases. So similarly, like in the first scenario or the third scenario we've seen, if we take preventive steps early on in life, we can obviously delay the onset itself of major diseases. And at the same time, if we do regular health checkups, if we are on top of the disease, early detection of life-threatening diseases can be done. So like in scenario 2, where the gentleman, because he is well-controlled diabetic, he does his checkups regularly, he has been able to pick up the prostate cancer well in advance. Early detection is as good as access to good treatment. Delayed treatment is equal to denied treatment, we say. Then definitely the expenses can be cut down because you have prevented the complications, and hence uh, expenses on those treatments are much simpler. Next, we can prevent hereditary diseases. This, of course, needs a lot of other work. It's not simple in the form of either a health checkup, but definitely either genetic diseases or hereditary diseases in the form of diabetes, blood pressure, cancers, or heart issues, strokes. All of those can definitely be um, picked up much earlier if we do take care of preventive medicine. A happy family, yes, it's always said, if one person is ill in a family, it definitely involves a lot of stress for the entire family. And then we have a saying, who cares for the caregiver? So it's the caregivers who undergo equal amount of stress along with the patient, because the quality of life would have deteriorated, the routine activity, routine life is disturbed, and it obviously hampers a happy family, a healthy body, a healthy mind. Definitely, if we take care of our health well in advance, it helps in maintaining a healthy body and a healthy mind. Is the slide changing?
No, I think you need to change it. Yeah,
Yeah, I
now it's
think.
changed.
Okay. So what is the importance of preventive healthcare? So preventive healthcare is a proactive approach to addressing healthcare concerns. Attempts to deal with issues before an emergency room visit or a hospital visit is warranted, so that before the illness has progressed past the point of effective treatment. So I want to highlight the importance of effective treatment. I am not saying that treatment may always be unavailable, but there might be points in life where there is lack of, or limitations to full or effective treatment if we do not take steps at the right time. So I want to just bring forward. Just give me a minute. So broadly classifying, what are the diseases that we need to watch out for? So always diseases are classified into two versions. One is communicable diseases, another is a non-communicable diseases. So the communicable ones are usually infections, which can be transmissible from one person to the other. And chronic non-communicable diseases are mostly lifestyle related diseases. So it's important to understand where and how we need to prevent these things. So on the left side of the screen, we have these chronic non-communicable diseases. We all are familiar with all of these problems that we see in our day-to-day life. So we have which has become very common now due to our poor exercise habits, eating processed foods, availability of easy and not so healthy food items, definitely increases the obesity. Fatty liver disease, this has actually the awareness for fatty liver disease has come up in the past 8 to 10 years, wherein it causes liver damage, and this is definitely preventable. Again, it's lifestyle related. Malnutrition, so either in the form of, so that's ironically the opposite of obesity. It does affect a lot of children in our country, and these again can be prevented or handled at an early level, early stage. Diabetes, we all are aware of that. We should do regular health checkups, regular sugar checks to understand what is going on in our body. Heart disease, whether it's a heart attack, whether it is any other form of rhythm disturbances, all of these can be picked up early if we do regular checkups. Blood pressure, regular blood pressure check at every visit, or even nowadays we all are aware of how blood pressure checks at home can be done. So being on top of the disease definitely helps us in controlling it well in advance. Stroke, different types of cancers. I'm not saying that every cancer shows up in the similar way. Definitely, we still need a lot of study and research in this field, but we always can correlate it with either our family history or our habits, and then try to organ, that is our oral cavity, our mouth. We assume that till we are able to eat happily or chew food happily, we don't have to worry about going to a dentist. So that's not how it works. And then mental health disorders. I think our COVID pandemic has really brought about the importance of mental well-being and mental health much more than ever before. We have seen how stress, anxiety has affected us in such a big way that it really leads to other such chronic disorders. So another important point about all of these non-communicable and chronic lifestyle disorders is that most or all of them may actually be asymptomatic. There might not be a single symptom because of which you'll be able to pick it up. I do have patients regularly coming in who tell me that I don't have any symptom. How do I know that my blood sugar is high? I do not have any symptom of high blood pressure. Then how did you detect that, my blood pressure is high? I am fairly healthy. I'm able to do all my office work. Then how can you say that I have a fatty liver or I'm, unwell? So that's the problem with these lifestyle diseases, that they are hidden, they are asymptomatic. That's the main problem about these things, and that's why here it becomes even more important for us to get into preventive medicine than uh, you know treat it after it has occurred. The other thing, we do have these communicable diseases. I have put viral fevers on the top because we all are quite aware of the COVID infections. And even there, we have seen how masking, social distancing, and vaccinations have proven to reduce the intensity of an infection. Dengue, which is spread by mosquitoes. Again, if we are taking preventive steps in avoiding collection of water and stagnation of water, breeding of mosquitoes, we can definitely prevent spread of this infection. Pneumonias, various types of pneumonias. We have vaccinations for those. Typhoid, which is again a food related infection, that can again be handled if we prevent or avoid eating contaminated food. HIV and other sexually transmitted diseases, I think that's the best example of preventive medicine, because when we take steps in the right way to prevent HIV, we know that it plays an important part, because treatment and vaccinations, of course, is not available for HIV in the way that we would want it to be available. So, these are the things we need to keep in mind when we are thinking about preventive medicine. So I want to give an example of, what are the different levels of prevention. So if we leave out the first one, that is primordial, and the last one, quaternary, I want to highlight the importance of primary prevention, secondary prevention, and tertiary prevention. And this is where I want everyone to correlate with the scenarios that I had brought about in the beginning of the discussion. So who has no problems and all reports are normal comes under the category of primary prevention. So primary prevention involves methods to avoid occurrence of a disease, either through eliminating disease agents or you increase resistance to the disease. So in his case, I had advised him to avoid occurrence of disease, that is diabetes or obesity or a fatty liver disease, by educating him about the disease agents, how to eliminate that. So a healthy lifestyle, a healthy diet, regular exercise will help in primary prevention. So here the disease has not yet occurred and we are preempting it because we know he's at risk of that disease, and thereby we are educating him to eliminate those disease agents. Scenario 2 and 3 were actually a part of the secondary prevention, where we have detected something, okay, and we address an existing disease prior to the appearance of symptoms. So the teacher who had started having back pains and headaches and is not exercising, there we have detected that of course there is something happening there, but before it worsens, it's time to take action. So again, this comes as a secondary prevention. The scenario 3, where the person had was a controlled diabetic and detected to have prostate cancer. So again, we have detected the disease well in time, and we will address it and we will attack it prior to the appearance of symptoms. So on a regular health checkup, the patient found that he has prostate cancer. He visited the doctor on time, and he's able to be on top of the disease and be in control of the disease rather than the disease being in his taking control of him. So this is a way of secondary prevention, wherein the appearance of symptoms or worsening complications can be prevented. Scenario 4, where this gentleman has come back home after a liver surgery, we will label it as a tertiary prevention. So there it involves methods to reduce the harm of a symptomatic disease. So you have picked up a liver cancer, you have operated on him, and he's back home. But through rehabilitation and through treatment, we are able to provide him a good quality life, thereby preventing, say, disability, death in the best possible way in each scenario. So nothing, of course, works in total. It's always customized to that disease or that patient. But broadly speaking, a primary prevention, a secondary prevention, and a tertiary prevention uh, goes a long way in having a good quality life. So to summarize, the different levels of preventive measures, we have the primary prevention. So you see that the pyramid, and actually this is a symbol for preventive health. So, taking care of your health or taking your health in your hands. I think it's a very subtle logo, and it conveys a lot of meaning. So the bottom of the pyramid, which is the widest, should be given to primary prevention, where health promotion, addressing risk factors, the social and genetic factors are all addressed. Secondary prevention or an early intervention. So in scenario 2 and 3, early intervention is the key word. Screening of at-risk individuals, controlling of factors, and early intervention to prevent going into complications. Tertiary prevention or a response, wherein you take care of rehabilitation, prevent complications, and again improve the quality of life. So I think this pyramid really conveys a lot in this simple way. So to give us examples of what do we do now, we heard that do this, do that. There's primary prevention, there is secondary prevention, there is tertiary, but what exactly do we do? So to give an example of, say, preventive care examples for primary prevention, infections or lifestyle diseases can be picked up, can be avoided by taking vaccinations. So you have vaccines, you have screenings of diseases, you have certain tests which pick up a disease even before the symptom has started. Flu shots, our COVID vaccine, which we have been seeing from the past 2 years, polio drops, pneumonia vaccines, screening for various cancers, say mammograms for breast cancer, colonoscopies for stomach and bowel cancers, pap smears for cervical cancers. All these come under preventive medicine because you are trying to prevent complication of the disease, and early detection of this disease helps in tackling it. Regular health checkups, I think they are the best way to propagate preventive medicine, and especially with our lifestyle now, wherein we have a poor lifestyle. A regular health check will help in picking up these lifestyle disorders even before they either become symptomatic or go into complications. Public health and education is another very, very important tool for preventive medicine, because when we empower each other, when we empower and educate our patient, our relatives, our friends, our staff, our children, it goes a long way in making the entire society and community healthy. The way we educate our children about good habits at home, sleeping at the right time, brushing their teeth, educating about the dangers of smoking, drugs, alcohol, teaching them the right way of hand washing, whether it's during COVID time, of course, things have become much easier for us to educate. But hand washing after some sport, or after going out and coming, before eating food. So these are small things which go a long way for preventive medicine. Nutrition and diet education, what to eat and what not to eat, and when to eat, how much to eat. These are three simple things. If we take care of that, we can actually avoid a lot of diseases in our life. Importance of exercise. Um, I think I don't need to elaborate the importance of exercise and maintaining an active life for preventing major diseases. The third example, this is not something as easy as step 1 and 2, but genetic breakthroughs, applications, making the patient aware of potential health issues by doing genetic studies. That's another way of mitigating and avoiding major diseases. So, just as a small graphic to help us understand this, primary measures like smoking ban, vaccines, healthy lifestyle campaigns, having these contests, having marathons, having small competitions, everything involves primary measures. And if we have noticed, this is not only in the hands of a doctor or your family, primary care provider. It's in the hand of every individual. So once we educate and empower our people, everybody takes part in this primary care and primary prevention. Secondary measures like blood tests, early screening and detection, this is where we come into play. Preventive medication, if we are able to give medications for a simpler disease, it obviously avoids going into major complication. Tertiary measures, wherein the disease has been diagnosed in the right way and now going into disease management, either in the form of surgery or in the form of uh, treatment in some other way. At the same time, we can form support groups, we can have rehabilitation programs. Suppose it's a post-surgical, post-op patient who's undergone a surgery, they will need rehab in this right way. So that's where all these measures come into being, and these are the different levels of prevention. Nothing is less, nothing is more, everything needs to go hand in hand. So preventive healthcare involves everyday healthy habits, specially recommended by a doctor. So whether it's eating habit, sleeping habit, exercise, um, uh, vocational habits, like we know, to de-stress, which is so important for our mental health being well-being. Second, regular checkups with your primary care physician. Third, periodic health screenings. So just to give a small example, if you do see your physician regularly, when you do your regular checkups, it's very easy to pick up either a high blood pressure or a small variation in your blood sugar, or increase in weight or a decrease in weight, or some symptoms which cannot be picked up without a doctor. Periodic health screenings in the form of health checkups should be taken up regularly, especially, I think this is the third or fourth time where I'm trying to emphasize the importance of a health checkup, mainly because the lifestyle disorders are always asymptomatic. If we wait for the symptom to come up, probably we are late. Immunizations is another way, vaccinations to prevent a majority of infections. So if you see the pattern of this leaf, so number one, which is primary prevention, takes a bigger share. Regular checkups, periodic health screenings are taken care when we do have healthy habits. And finally, all these immunizations and vaccinations play another important role. So we at RxDx SAMANVAY are trying our best to bring back the family doctor into the community. So I myself am a family physician, and we are the primary care providers. We are the doctors in the neighborhood, in the community, and on this World Family Doctors Day, I also want to appeal and request to the community to take steps or want to take this opportunity to also emphasize, so what is the importance of the family doctor in our life. So one is community presence. The doctor is present in the community and understands the dynamics of the society, also understands your family dynamics with regard to social aspects, financial aspects, emotional aspects. So example, there's a family wherein there are children involved, there are grandparents, or there are people who are traveling often, and if they need home care, if they need regular injections, if they need regular medicines, your family doctor who's sitting in the community understands all these dynamics. A very, very important factor is your family doctor is easily approachable and definitely affordable. Unfortunately, in the recent past, we have seen people seeking specialist care even for a small symptom, which actually does not need a specialist to intervene. Your family doctor, your primary care physician can take care of that symptom and give you the right guidance as to save time for the patient as well as that specialist, so that the specialist can also concentrate on treating serious disorders in a hospital setting or in a tertiary care setting, which and also provide better quality of care. At RxDx SAMANVAY, we we would to what is called the annual healthcare package for senior citizens. So it currently targets geriatric age group and provides comprehensive and affordable healthcare either at home or at the clinic or so this program that we have, it has home services in the form of doctor visits, nurse visits, blood collection at home. We provide chronic care at home either for a diabetic or a non-diabetic individual. Comprehensive assessment of all the issues or problems that a patient may be facing are given importance in this service. And of course, we do provide telehealth services as well at this under this program. So more things will keep coming up on our website as well as on our social media. So do watch out for the launch of this geriatric home care package. So to sum it up, importance of preventive health care. What are the benefits? So most preventive care at no cost to you as part of your health coverage. Early detection of medical problems, illnesses, diseases helps the doctor also provide proactive care and treatment. So we have had many situations wherein the healthcare provider feels feels lack of capacity to be able to provide full treatment because either the disease has been detected at a later stage or the patient has come in too late or the complications have surpassed the point of or the capacity of full treatment. So early detection is really important. Routine care can help us stay focused on our own health goals, and we have quite a few examples now where technology has also helped us in supplementing us for taking care of health. For example, we have smartwatches, we have our smartphones, which constantly track our weight, constantly track our heart rate, and of course, there are some devices which give out our ECG readings, temperatures, and all of that. So we only need to ask for help and we need to be aware of what we need to do. I'm sure a lot of resources will be available on our fingertips. And probably when we go ahead, we will find many people who are in our shoes who will be able to help us out or support us in ways we cannot imagine. Because preventive health is a continuous process through the person's life and in different stages of life. So a child needs different type of preventive care, an adolescent needs something else, a pregnant lady needs some other type of care, an office goer needs something else, our parents, our grandparents, everybody needs different types of care at different points in time. So it's a continuous process. And preventive care definitely helps in mitigating the impact of an existing disease on the overall well-being of the. So I think it's important that we keep in mind something that we have learned from long back: prevention is better than cure, and I think it's the right time that we go ahead with this. I think COVID has really taught us how prevention and taking care of our health should be prioritized in all ways. Just closing in on family are there today. And with this, we would like to also thank everybody to help us in bringing the family doctor back to the community. Thank you.
With this, we have come to an end to our today's session with Dr. Jyotika. Thank you so much for all your time this evening for explaining us the importance of preventive medicine role of your family doctor. And it was lovely hearing, and the insights which you shared were really amazing. So we look forward towards more such sessions with us. And thank you to our viewers who have been supportive in listening to our webinar sessions. And with this, we uh, end of our day. And thank you so much, Dr. Jyotika, once again, and RxDx SAMANVAY for supporting us in organizing this session.